Cerebral palsy refers to a group of neurological disorders that appear in infancy or early childhood and permanently affect movement, muscle coordination, and balance. The most common symptoms are a lack of muscle coordination when performing voluntary movements, stiff or tight muscles and exaggerated reflexes, difficulty walking, and muscle tone that is either too rigid or too flaccid. There are a few common classifications of the disease, the most common being spastic cerebral palsy, which is characterized by stiff muscles that are permanently contracted. Cerebral palsy is the most common form of permanent physical disability in childhood. It is estimated that 1 out of every 500 babies have cerebral palsy, and up to 1 in 3 premature babies are affected to some extent. There are over 50,000 Canadians diagnosed with cerebral palsy. The symptoms of CP are caused by brain lesions, but their exact cause remains unknown. Prevalent risk factors for the disease are peri- and neonatal factors such as prematurity and low birth weight, stroke, shaken baby syndrome, and birth asphyxia, with prematurity being the main risk factor. The manifestations of the disease are dependent on the location of the brain lesions. For example, if the lesions are on the upper motor neurons, the person may experience spasticity, hyperactive reflexes and/or weakness, and if the lesions are on the lower motor neurons, they may experience flaccid paralysis, decreased reflexes, and muscle atrophy. These symptoms make it very difficult to walk and to perform many activities of daily living, such as eating and bathing. Up to 60% of people with cerebral palsy also have epilepsy, worsening the patient's prognosis. Children with mild to moderate CP may be able to walk between the ages of 2 to 7, although those with severe physical disabilities and other accompanying health concerns may never walk and have a shorter life expectancy. Approximately 40% of people have learning disabilities or cognitive impairment, but during adulthood, 50% of people with spastic CP live independently, and 53% of all people suffering with CP are able to work outside the home in regular jobs. Treatment for the disease is improving mobility and symptom management. This is accomplished with mobility aids such as wheelchairs, braces, and walking apparatus with the support of physical therapy. Surgeries may help to improve mobility by reducing tense muscles and contractures. And certain medications assist in symptom management, such as muscle relaxants and anti-epileptics, as seizures commonly accompany the disease. Some health tips for those with cerebral palsy are to keep good dental hygiene. It is also important to attend regular visits with their healthcare team and to consistently follow the care plan, which can include taking prescribed medications and routine exercises. This has been an educational public service announcement, proudly presented by Natalie Foster, Vicki Lewis, Malat Yzengau, and Paul Zelstra.